Welcome again. I know you've done thousands of hair transplant procedures, so you've probably seen this at a scale, not only just like one of cases. And I believe that you have like a lot of data and insights on this topic. So I think for today, what's going to be really interesting is like your stories and your insights about how hair can be a reflection of our overall health, as well as like I will have some questions to you regarding some other issues that a lot of people experience. So I'm really excited to get into that with you. But before we get started, I would love to hear more about your background. So why don't you like just jump in and tell us about yourself?
Thank you, dear Jansu. I'm Dr. Burak, Medical Director of Esteworld Plastic Surgery Health Group. I always say like that everybody born in hospitals, but I grow up in hospitals because of my family. My family is in health area since 1994. More than 30 years, my father and my mother managing the biggest aesthetic hospital in Europe, named Esteworld. Esteworld, we perform hair transplantations, dental surgeries, plastic surgery operations. So when I was a child, I always see the doctors. Yeah, there are lots of nurses around me, and I always want to be the best doctor in my field. I grow up always like this imagine.
Uh-huh.
So after medical, together with medical university, I also trained American Academy of Aesthetic Medicine to increase my skills. I graduated from Acıbadem Medical University in Istanbul. It's also the best medical university in Turkey right now. And after that, I start hair transplantation and hair treatment. So we say it hair restoration. First of all, we have to understand the reasons why we lose our hairs. We have to understand the reason to solve the problem.
Yeah, I was gonna actually ask you, like, what are the most common underlying causes you see that people completely miss? Like, if
Yeah.
someone's hair starts thinning, what should they be checking before like jumping into treatments? Like in terms of like
So
micronutrient deficiencies, I don't know, inflammation, stress, you tell me.
first of all, the man and the woman totally different. The
Different.
hair loss causes are different, the reasons are different, and the solutions are different. So first of all, we have to choose one of them. For example, for men, the male type andropesy called androgenic alopecia. The main reason of the androgenic alopecia is testosterone. The testosterone hormones turns to dihydrotestosterone, DHT.
Okay.
These days, it's a well-known hormone right now
Mm.
if somebody has a hair loss. So there is an enzyme called 5-alpha reductase. This enzyme also decrease blood circulation in the hair scalp. So not just because of the testosterone effect.
Got
The
it.
reason is the turning of testosterone to dihydrotestosterone. And when it's turning time, the enzyme 5-alpha reductase decrease the blood circulation in the hair arteries. I want to show here. Okay. This is our hair anatomy.
Okay.
You can see epidermis and dermis layer of the skin. So in this dermis layer of the skin, we have blood arteries, blood vessels.
And this is
This
the same
blood,
for men and women, right?
this is the same,
Okay.
exactly. So the blood arteries in the androgenic alopecia, if the blood circulation decrease in the blood arteries in the dermis layer, we see that the hair follicles getting thinner, and
Mm.
after that they fall down. So if hair loss is more than 100 per day, we can have a permanent hair loss in hair
Mm.
scalp. Less than 100 is a normal
You
procedure.
mean like baldness?
Exactly. More than 100 cause
Got it.
baldness.
Got it.
So mainly genetic reasons affect this androgenic alopecia. And if some male know that their father, uncle, grandfather has hair loss, and if the male feels that they also have hair loss, mainly it happens 18 to 45 in
Mm-hmm.
these ages. So if they feel like that, they have to do something immediately protect to their hair before
Okay.
hair transplantation. We always recommend preventive approaches in these situations.
What are they?
So
This is for both men and women.
This is for both men and
Okay.
women. Exactly.
Rosemary
The
oil.
exactly. I gotta explain also why women have hair loss. I will explain the reasons. Both men and women has to do something if they have hair loss immediately before getting baldness. Because if we are bald, we just have one solution, hair transplantation. But before that, when we realize that we have hair loss, we have hair falling, we can do some other options,
Okay.
some minimal invasive options. So we have hair loss. We understand the blood circulation decreasing in the hair arteries. We have to increase the blood circulation. How we can increase? There are two type of medication worldwide. One of them is minoxidil, the other one is finasteride.
Okay.
These two medication, minoxidil has vasodilation effects. Vasodilation means enlarging the arteries. So when we enlarge the arteries, the blood circulation increase in that areas. This
Okay.
is minoxidil effect. Of course, the ratio is important. Of course, the doctor has to prescribe the patient how to use it, how many days and how long, how often.
Mhm.
These are the important ones. And the other one, the other medication is finasteride.
Mhm.
Finasteride,
And these are in the form of like oral tablets. Like, what are they?
there are different type of forms.
Uh-huh.
We have spray, gel, serum, or
Got it.
tablet. There are different type of forms. For
And they
example,
have
I
to be
recommend
prescribed. They're not like over-the-counter products.
they can find without prescription, but as a doctor, I recommend this medication has to use
Got
under
it.
doctor control.
Got it.
It's important because we also see some side effects.
Got
If
it.
it's not under doctor control, we see some side effect. But if it's under doctor control, you can manage all the
Got it.
situation very
Yeah.
well.
Okay.
The other medication is finasteride. The finasteride effect is to stop turning of testosterone to dehydrotestosterone. So finasteride effect is to stop the reason of hair loss.
Mm.
In my first sentences was, as I said, turn in the androgenic alopecia, turns testosterone hormone turns to
Got
dehydrotestosterone.
it.
There is an enzyme. So
Mhm.
finasteride is blocking this situation.
Got it.
So we recommend generally local use of finasteride to not feel any kind of systemic side effects.
Got it. Got it.
These are medication, and also we have some regenerative treatment to feed more hair follicles, like exosomes, like stem cells,
Mm-hmm.
like low laser band,
Mm-hmm.
or still we are using PRP more than 20 years, or mesotherapies. These are some regenerative treatment to feed more hair follicles.
At the moment, do you see more men coming for transplant or women?
For transplant, men. For treatment, women. So
Got it.
let's come to the woman hair
Okay.
loss situation. Generally, women feel hair loss because of the some deficiencies like vitamin D deficiency or iron deficiency anemia cause hair loss in the woman, or
Mhm.
testosterone hormone dysfunctions cause hair loss in the woman. Before the treatment plan, we always want to see some test results
Got it.
in the woman. In the men,
Okay.
yes, we can do some tests, but we know the reason generally and we
Yeah.
know the solution. But for
Yeah.
the woman, we have to understand the reason
Yeah.
underlying the hair
Plus, as
loss.
women, like we play with our hair quite like much more than
E-
men.
Exactly. Yeah, of
Although
course.
there are a lot of men now
Colors.
who dye their hairs, but like in
Mhm.
general, like I feel like it's women that like, we go in and basically mess the hair. So
Exactly. I totally agree. The chemicals, the colors, or
yeah,
some
exactly.
heat dryer, something like
Exactly also.
yeah. Yeah, unfortunately, this is harmful for the hair
Yeah.
health. So, what we recommend for women, where our first approach is to fix the situation. If there is an thyroid dysfunction, we manage this situation together with endocrinology specialists. Or if we see iron deficiency anemia, before everything, we have to use some treatment for iron deficiency.
Hmm.
And after that, we recommend some kind of regenerative treatment like exosome or low laser band or PRP or stem cells like
Hmm.
that.
Interesting.
So this is the worldwide hair loss scale called Norwood hair loss scale. So you can see 7 different type of hair loss from 1 to 7.
Interesting.
For treatment, I'm talking for till Norwood 2 actually. So
More
if
like from the
somebody
front.
has, if the patient lost their hair follicles permanently, if there is no sign of hair follicles thin, the treatment unfortunately cannot affect enough for the patient. So if the patient lost their hair like that,
It's
if there
gone.
is a baldness, yeah. So we have just one solution is hair transplantation. There are also some important factors to get a natural look to hair transplantation. I can give brief information about that also if you want.
Before that, like for women, so obviously, like there are different cases. It can be estrogen versus like progesterone imbalance, or as you said, like also like PMS or perimenopause effects, etc. For like 30 plus women. Let's say, because like after shower or like after combing your hair, like how much hair should come to your hands? Like when you do this, like how much hair is normal and how much is not normal?
So actually, there is some diagnostic approach. For example, we have a stretch test like that.
Okay.
When you do like that, if you have more than 4, 5 hair follicles, you
Let me
have
see.
to think about that. Yeah.
One.
One is good. Your
Okay.
hair is healthy. And also, of course, one more important thing, when did you wash your hair? For example, if every day you wash your hair and if you have every day 5 to 10 hair is too much. But if you wash your hair 2 or 3 times a week,
Which
and
is
if you
better?
depends on the situation actually, you can wash your hair every day with water. There is no problem. But we generally recommend that you can use shampoo twice a day. It's better.
Twice a week.
Sorry. Every 2 days.
Every 2 days. Okay.
Yeah, every 2 days is
Got
better
it.
for the
Okay.
hair scalp.
There's I cannot drop a
If
name, but
I'm
there's this Instagram personality. She's like, okay, this if you follow this ritual, like she swears on it that your hair won't be thinning, won't be like shedding. Is there like such a natural ritual that people can follow to
Of course.
what's the secret?
For example, the easiest one every day, if you massage like that 5 minutes, it can help also increasing blood circulation.
Scalp
This is the
massage. Okay.
exactly this is the easiest and the basic
Okay.
one. Or if you use dermoroller every 2 days, it also increase blood circulation.
Interesting. Okay.
Or if you want to get much more result, you can use some serum like minoxidil finasteride to increase hair thickness.
Mm.
So if you want to get better and better result, you can use low laser band hat or stay under the low laser band machine. So
Mm.
if you want to get better and better result,
Okay.
you can add some kind of regenerative
Is
treatment. So
rosemary really good or like Indian oil?
minoxidil comes from the rosemary actually.
Oh, okay.
Yeah. So yes, rosemary is good, but you know why the doctors generally recommend medications? Because we know the doses and the effect of the doses.
Got it.
So we can recommend, of course, I can recommend rosemary. Rosemary also help your hair growth and hair health,
Mhm.
but everybody can
Like how
use
much is
different.
important?
Exactly.
I see.
Exactly. You understand.
Okay. When you look around like at these trends, or even like when you go to markets, there are so many like oils. Like, are they really helpful or are they just like hypes? Like, there's like argan oil, like, or coconut oil, like those generic ones that you see in every market. Like, do they really help or not?
I can say even without oil, just the message, it can help also, as I said.
Uh-huh.
So of course these oils can do something minimally or maximum, but some of the oil can be allergic of your hair scalp. Some
Got
of oil can also be harmful. So what I recommend to you, first of all, if you have hair loss, we have to understand the reason why you have hair loss,
it.
why you have hair thinning, why your hair quality are decreasing.
Hmm.
is we can understand with some testing.
Is it possible to reverse the health of your hair scalp?
Exactly. If the baldness
Hmm.
haven't start yet like that, yes, we can reverse it.
Reverse it.
But if you
That's good
lose
news.
permanently, if we lose permanently, so yes, we can reverse with hair transplantation.
Got it. I mean, now the summer is coming and people will be more like outdoors, like under the sun. So I want to ask you about sun protection and
Yeah.
also given like a lot of people are now following these longevity protocols, especially with saunas, how can we protect our hair from heat? Under the sun and in the sauna.
Actually, our hairs protecting our head, actually. So these are our protection
Mm.
mechanisms. So we have our most important organ is our brain. As you know, we have a skull, and after that we have some layer of the head skin, and after that we have hair to protect our brain. And if you want to get stronger your hair and the station, by the way, your hair looks so nice, I
Thank you.
can say. You're
I lost
welcome.
so much, by the way. This is like, it used to be like 5 times more, but anyway.
We should stop it and we should get stronger again. But because before I recommend something, it's better to make a consultation because
Yeah,
everybody
check the
is
blood work
unique.
and everything. Yeah,
Exactly. Everybody is unique. Everybody's needs, the situation, the causes, reasons, solutions are unique. So
right.
it's just need one physical consultation. We check the hair scalp and hair root situation under the dermoscope, and
Wow.
also we check the blood situation, testosterone, thyroid hormone functions, biotin, zinc,
Iron.
vitamin D, iron. So
So
all
many.
of things give us an opinion what we recommend to our patient.
I
And
see.
after that, we recommend something. When the patients are using these medications or treatments,
Mm-hmm.
so you can get stronger your hair under the sun or even
Yeah.
under
But
the
like, do we need to
snow.
cover like with a towel or no? Like, for example, when you go into the sauna, are you supposed to like make your hair wet before going in?
Yeah,
Or do you need to like wrap with a towel before going into the sauna or not
actually, it doesn't
necessarily?
affect so much,
Really?
because how many minutes do you stay in the
10
sauna?
minutes.
So, we have 24 hours in a day. So the sauna doesn't affect so much in this 10 minutes. So
Got it.
we
Interesting.
have to stronger our hair scalp general in life, with these treatments. So you don't need to
Mm.
make sure
What about when
use
we dry our hair with these hair dryers?
not so hot. I don't recommend not so hot.
Not so
With
hot.
Yeah, exactly. It has to be a uh, warm, not
Okay.
so hot.
And those like irons are not good for the hair,
Yeah,
correct?
of course.
You're
Yeah,
burning
we
the hair.
exactly.
Interesting. Okay.
Yeah,
In terms of like some like future of hair kind of topics, like
yeah.
innovations, what excites you the most right now as it relates to, I don't know, stem cells, regenerative medicine, like what's coming, what's here now that's like super cool.
So every year I join congresses like FUE Europe or International Society of Hair Restoration Surgery or the World FUE Institute. So I really like to speak about regenerative treatments.
Mm. What are they?
Now, nowadays, we talk, and we see the best result on exosome treatment.
Mm.
Exosomes are small particles. Their diameter starting from 14 nanometer to 100 nanometer. I can summarize like that. Our smallest units are cells, as you know. They are small, 10,000 times smaller than our cells.
Okay.
So exosomes can easily go inside and outside of the cells. They have messages. They carry some messages. They stop inflammation, they decrease inflammation, and they have some growth factors to feed the cells. So exosomes are emergent treatments these days. There are different type of exosomes. The source of exosomes are so important. The source can be human-based or plant-based or animal-based exosomes. Exosomes is actually a name. Exosomes is like a bag, small bags. So if these exosomes has much more concentration of growth factors, proteins, nucleic acids, insulin-like growth factors, they are rich exosomes. But if the concentration is less, they are poor exosomes.
Right.
So the rich exosomes can have better effect on hair scalp.
Mm.
Also, we use this exosome treatment in face regeneration, or some orthopedists use for the knee regeneration. In our field, we use hair and skin regeneration. And this is the best regenerative treatment these days. But
From
if you
humans, like,
have,
is it from the same person? Can you tell a little bit more about the details of where you guys pull from?
yeah, we are using human-based exosomes. They are coming from the wharton jelly. Wharton jelly is when the baby borns, they are
Yeah.
cable between placenta and the baby.
Mhm.
Normally, this Wharton jelly in the past they were going to rubbish, but nowadays we understand that the Wharton jellies also has some stem cells, some proteins, growth factors, and they are so efficient for the regeneration.
Wow.
So in the laboratory, of course, the GMP laboratories, they make something to make it for unnamed without toxins. From the laboratory, the exosomes comes to us and we use it. And also we sometimes we use plant-based exosomes,
Just
but we see that the best result is coming
from
from
the.
the mesenchymal stem cells.
Okay, that's
Exactly.
very cool. Thank you for
Yeah.
all the insights. As this is
I
like,
want to add one more thing,
yeah, please.
Mirjan. So I say exosome and regenerative treatment is so we have amazing result. But to get a permanent solution of the hair, mainly in men, permanent result comes from the hair transplantation. Nowadays, the hair transplantation is so popular. But to get the best result, there are some important factors. I want to say some steps and factors. If somebody want to get hair
Yeah.
transplant, they have to know and they have to
Yeah.
have in their mind. The hair transplantation process has two steps. The first step is the extraction step. In
Mm-hmm.
the extraction step, the surgeon has to take just one graft, around 6 to 7 hair graft. If somebody took more than one, let's say 2 or 3, there can be a scar tissues, empty spots in the
Mm.
donor area. This is one of the important thing in the extraction. And the second one, the root has to extract alive. They are going with some degree under the skin. So we use a FUE machine robot to extract it. If the machine is so fast or if the angle is not correct, somebody can harm to hair follicles and the hair follicle cannot grow very well after this surgery. These are some important factors. And
Interesting.
to get a natural look, in the second step is implantation. In the implantation
Mhm.
step, we have four important steps. The first one is the natural front line. Everybody has unique and different front line. We design front line based on the face anatomy, the golden ratio, and also the different situation on the face. The first one is the location of the front line. The second one is the angles. When we implant the hair follicles, to not look like a grass man, the hair follicles has to start from 15-degree angle from front, then it has to continue 30-degree angle in the crown area. Angles are important. The third thing is the density. We recommend to 60 graft per square centimeter to get a natural look, natural density. And the fourth thing is the directions. All the hair follicles has a original directions to not like these
Yeah.
situations, not look like that. the directions are important. These are some important
That's
factors.
really
I
fascinating. When you even think about these details, like I'm once again amazed by the human body and how we are
Yeah.
made naturally. And it's just really mind-blowing to hear about this. No, thank you so much. Like I think this is really helpful for people who are like considering this. So lastly, like what's recovery look like?
After surgery, 10 days later, our patient can swim in the sea, can
Really?
ski. Yeah,
Yeah.
everything will be easy.
Yeah.
2, 3 days later, the swelling and redness almost done.
Hmm.
5 to 6 days later, there is just some scabs, but no redness, no inflammation, nothing. 10 days later, there is no scabs. It's like a short hair, but nowadays we can do hair transplantation without shaving hair also.
Oh, really?
So yeah, exactly. 10 days later, nobody can understand they got hair transplantation.
That's really cool. Thank you so much. How can people find you before we go?
As I said, I'm medical director of Esteworld. Esteworld is the biggest aesthetic hospital in Europe. I'm medical director, and more than 100 doctors working in Esteworld, more than 1,000 staff. We have offices all around the world. We have 35 offices in Europe, Asia, and United States. One of our office in New York right now. So our representative Mel, she's a helpful girl actually. She can help our patient to answer all of their questions about all the aesthetic surgeries and hair transplantations.
Yeah, and under this video, we will add contact information so people can find you guys through that info. Thank you so much. Really appreciate your time. I definitely learned a lot today about hair. So it was super enlightening. Thank you.
Thank you. It was amazing for me. It's glad for me also. I wish we can have one more podcast also to talk detail about other surgeries and detail about hair transplantations, dear
For
Cansu.
sure. Yeah, we can definitely do that. Thank you.